Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about the pre-operative assessment that we need to perform before we go into performing rhinoplasty. Now, this is a very important theory question that you get. Even practically, you may be asked this in your viva, like how do you assess the patient pre-operatively for rhinoplasty? This is a very, very important question. And as postgraduates, we often struggle with this. So today we'll be addressing this topic, and after this, in our next classes, we'll discuss more about rhinoplasty in itself. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. So first of all, as a patient comes to you for rhinoplasty, what do you do? So in your initial consultation, there are certain things that you need to be assessing when you're talking to your patient. So rhinoplasty in itself is an elective procedure, right? It's mostly never like a procedure that is an emergency procedure. This is an elective case, and mostly this is meant for cosmesis. This is basically an aesthetic surgery. So it is very important that you spend a lot of time in this consultation getting to understand what is the motivation of the patient over here. What do they want? What are they actually seeking for? Are their demands based in reality or not? So understanding the patient's motivation, the reason behind why they are asking it is very important, and also understanding what are they expecting from you. Are these expectations realistically achievable or not? Then, especially patients who are males, and even in cases of revision surgery, we have to be a little more, you need to be probing a little more into the patient's demands, because these cases can actually end up being troublesome. Like you may end up facing a lot of these immature patients who are, a lot of them are end up being males in these cases, who are having some kind of psychological disorder or body morphic disorder. And especially in cases of revision surgeries, you need to be a little careful about what you're walking into. So before you take on a patient, you have to understand the psyche of the patient first. Next, you try to understand, okay, what is the deformity that you're going to be correcting? And is the patient's, the concerns about the patient's deformity, is it real or is it very exaggerated? Is he portraying it to be far more than what it actually is? And sometimes even patients can come to you where they can just ask for a few changes, like maybe removal of the hump or straightening the nose, while at the same time ignoring other issues that may be there, maybe in the tip or the septum or etc. Your job would be to perfectly assess your patient and tell them all the things that should be changed in your opinion. And in case your patient needs an augmentation, then you also need to discuss with your patient about taking a graft and what are all the locations from where you can be taking the graft, and discuss about that as well. Next is, what approach would you be taking for the surgery? Would you be going via the open technique or the closed technique? And you should be talking about both the procedures, what are the pros and cons for each, and what kind of complications may arise from your technique, and even discuss the internal nose. So if there is a internal nasal deformity, like maybe a septal deviation, that should also be corrected at the same time, if it is indeed causing a functional issue. In that case, that is also something that you need to be addressing with your patient. And lastly, post operative discussion is also required, like what will healing look like for the patient, what kind of pattern will it follow, and what type of anesthesia also you're using in your case. So all of these things, these are so many different things that you need to be discussing with your patient, trying to assess your patient. Are their requests legit or are they a little exaggerated? What are their expectations? These are all things that you will be discussing in your initial consultation. Now that your initial consultation is done, next we move on to assessing the nose. Now this we'll divide it into different parts. First, we'll be trying to understand how do we divide the face? How do we analyze the facial proportions? After that, we'll be discussing about how do we inspect the external nose, how do we inspect the internal nose, and then we'll perform palpation as well of the nose. And lastly, we'll also talk about some angles in the face which are very important from the aesthetic point of view. So first, let's talk about dividing the face. So there is this rule that we follow where the analysis of facial proportions is performed using the rule of thirds and the rule of fifths to assess the face from the frontal view. Now let's look at the image over here. This is a frontal view of the image, right? So first we'll talk about the horizontal division. So horizontally, we follow the rule of thirds. Here what we do is we have different landmarks and we divide the face into three portions, one third each, and they should be approximately equal. Now, what are the landmarks that we are following over here? So the first horizontal line goes at the level of trachea. So trachea, what is trachea? Trachea is the level at which your anterior hairline is present. So first horizontal line goes at the level of the trachea, which is at the level of anterior hairline. The second horizontal line will be at the level of glabella. Now, in my previous class on surgical anatomy of nose in relation to rhinoplasty, I discussed about glabella. Glabella is the most prominent port point in your forehead. When you palpate it in the midline, the smooth prominent point that you're able to palpate, which comes in between the eyebrows. This is known as glabella. So the second line goes at the level of glabella. Then our third point is known as subnasally. Now, what is subnasally? Subnasally is the junction of the columella and the upper lip. So this is your columella is over here and this is your upper lip. And the junction of this is in the mid-sagittal plane is known as subnasally. So our third line goes at the level of subnasally. And lastly, the fourth point that we have is known as menton, and menton is the lowest point of the mandibular symphysis. So our fourth line goes over here. So you can see how these four lines have divided the face into three equal portions. Therefore, this is known as the rule of thirds. And another line in the horizontal direction that we need to know about is known as the Frankfurt line. Frankfurt line. Now, what is Frankfurt line? Frankfurt line is actually an imaginary horizontal line which is joining the upper border of the external auditory canal to the infraorbital margin. So a line which passes, imaginary horizontal line which passes at this level. Now, what is the importance of this Frankfurt line? The importance of this is we standardize the analysis of facial proportions using this line. So when you are positioning the head has to be positioned such that this Frankfurt line is horizontal. That is the position of the head where it should be before you start analyzing the face. So this was our rule of thirds where we divide the face horizontally into three equal parts. Next, we have the rule of fifths. Now, what is the rule of fifths? Rule of fifths is basically it is dividing the face vertically into five equal parts, and each of these equal parts, this you can see these 1/5, 1/5, 1/5. Each of these equal 1/5 part is actually equal to the width of one eye. So let's see over here, this line over here that we are passing, this line passes through the medial canthus. So we have two lines which are passing through the medial canthus. Then we have two lines passing through the lateral canthus and two lines passing at the level of the ear. Now you can see this width that is forming, the 1/5 width. This is actually the equal to the distance or the width of one eye. And this here, if you look over here, this is the alar base, right? This alar base, you can see how the alar base is actually equal to the intercanthal distance, which should be equal to the width of one eye. So this is how we divide the face vertically into five equal portions. So this is known as a rule of fifth. Another thing that we need to know is now the nose that you're seeing over here, let's see here. So if you look at the nose over here, you'll see that the nose will ideally occupy 1/3 of the length of the face and 1/5 of the width of the face. So, this is how we will be analyzing the nose and analyzing the different facial proportions using the rule of third and the rule of fifth. I hope this is clear to you, all the different landmark points over here, the trachea, the glabella, subnasally, menton, and the Frankfurt line, and what is the importance of Frankfurt line. Next, we'll talk about inspection of the external nose. What are the things that we will be inspecting over here? First of all, when you are just looking at the nose, what is the first thing that you notice? We will be noticing the skin of the external nose. Now, assessing the skin is very important because the quality of the skin, how thick is it, how thin is it, or is it sebaceous? All of these things are actually very important in your surgery because thin skin is actually very difficult to deal with, and even very minor irregularities will be very easily detectable. So, you have to be very careful when you're dealing with the thin skin. Whereas in case of thick skin, what you'll see that refining and narrowing the nasal tip can get very challenging if the patient has a very thick and sebaceous skin. So the skin quality definitely has an impact on your surgery as well. How healing will happen depends on this. So this is the first thing that we see. Second is we look for deviations. Now, how do we look for deviations? Now let's look at the three faces that we have over here. So what we'll first do is we'll divide the nose into three portions: upper third, this is the upper third, middle third, and lower third. The upper third will correspond to the bony vault. I have already discussed about this in the surgical anatomy video which I have created before this. You can check out for more details to understand what is the structure of the external nose. Then middle third forms the upper lateral cartilages and the dorsal septum, and the lower third forms the lower lateral cartilages, the caudal septum, and the alar base. So we divide the nose first into these three portions, and then when we describe the deviation that we are seeing externally on the nose, we will describe it on the basis of direction in each third. So this is the first image is this is how a C-shaped deviation will look like. If we look here, this is what a C-shaped deviation will look like. The second image is where you can see only a one-sided deviation. And a third image, you can see how this forms an S-shaped deviation. This is how we are going to be describing the deviation of the external nose. Next, we'll look at the length of the nose. Now, how do we measure the nasal length? Let's look at the image over here. We have some points over here. We have the nasion. We have the tip of the nose over here. We have the stomium. And we have the menton. So, the nasal length is actually measured from the nasion to the point of the tip of the nose. And these are all terms that I've already discussed in my previous video on the surgical anatomy. What is nasion, etc. Now, this distance that we measure, that the nasal length from the nasion to the tip, this is actually equal to the distance between the stomium and the menton. So these are some proportions you need to remember. And there's another formula for nasal length where nasal length is actually equal to 1.6 times the distance between the nasal tip and the stomium. 1.6 times the distance of this portion. So these are some things you need to remember in relation to the length of nose. Next, let's look at tip projection. What does tip projection mean? Tip projection means is actually a measure of how far the nasal tip lies anterior to the face. So this is the level of the face. A line that is passing at the level of glabella. And this is the tip of the nose. How anteriorly, how far is the nasal tip lying anterior to the face? Now, the ideal projection over here will be determined using a ratio that is known as the Gooday's ratio. Now, what do we do here? Here, we first draw a line from the alar facial groove to the nasal tip. Let's look at the image. The A is the alar, T is the tip, and N is the nasion. So first we draw a line from the alar facial groove to the tip of the nose. And then we also draw a line from the tip of the nose to the nasion. Now, this line from the alar facial groove to the nasal tip has to measure about 0.55 to zero point 0.6 of the distance between nasion to the nasal tip. This will give you a good tip projection. Any ratio which will be more than this ratio that I have mentioned here will be an over projected nose, meaning it is pointing way forward, and a ratio that is less than this will be an under projected nose. So, this formula over here will help you understand how much anteriorly the tip should lie in front of the face. So, this is about tip projection. Next, moving on, we'll look at something which is known as the lip and chin relationship. Now, what do we do here? So, here, some things that we need to know. We have, if you look at the image here, there are two parallel lines running here, one at the level of the lower lip, one at the level of the upper lip. Now, the horizontal distance between these two lines, which are running at the surface of the upper lip and the lower lip, should be normally about 2 millimeter. So, this is one thing that you need to know. Second is the anterior surface of the upper as well as the lower lips. They rest on the nasomenton line in an aesthetic phase. A nasomenton line, this other line that you are seeing over here, this is the nasomenton line. So both the surfaces, the anterior surfaces of upper and lower lip should be resting on this nasomental line. Now, how does this matter? Why is this important? So you will be seeing this line, the nasomental line, if the chin is lying posterior to this line. If you look at the image over here, you can see how the chin is actually lying posterior to this nasomental line. If the chin lies posterior, this is actually a retrognathic face. This will, a chin which is lying way behind, this will actually give the illusion of an overprojected nose. So in this case, it is important to understand that there is a chin deformity involved here as well. And the second thing, if the chin lies anterior to this line, as in this photo that you're seeing over here, in that case, this is known as the prognathic chin. So, a prognathic face. So, this will end up giving the illusion as if the nose is under projected. However, it is up to you to understand that this is actually a chin deformity and not a nasal deformity. So, therefore, understanding the lip and chin relationship in relation to the nasomental line is very important to see if the chin lies on the nasomental line. Moving on, let's talk about the dorsum of the nose. Now, when we look at the dorsum of the nose, the ventral aspect of the nose, we look at it from two views. We look at it from the frontal view and we look at it from the lateral view as well. Then we have to trace the lateral aesthetic lines, which is also known as the brow tip line. And this brow tip line should be revealing a smooth curvilinear line which connects the eyebrow superiorly to the nasal tip. If you look at the image over here, this is what a brow tip line looks like. The reddish line that is passing, it's a line that starts from the eyebrow superiorly and it goes up to the nasal tip inferiorly. Now, this line is actually supposed to be a smooth curve. Any irregularities in your patient, if you see that there is any irregularities in this smooth curve, that will help you in identifying what is the source of the nasal deformity. And you'll also see that in this brow tip line, this portion that you're seeing, we can see 4 points over here. These are the 4 tip defining points that are usually identified with the help of light reflection. These 4 defining points are the 2 domes, the supratip and the infratip. Then also in the lateral view, we will also assess the height of the dorsum. And dorsum is supposed to be actually a straight line in case of men. And in women, gently curves with a supratip break delineating the dorsum from the nasal tip. That is how it usually is in men and women. So we have assessed the dorsum of the nose. We have looked at the brow tip line and if there's any irregularity in this smooth curve. Next, we are going to look at the tip configuration. A lot of people have these tip deformities. So I told you about the 4 tip defining points. These are some points that you will be looking at, and you will be trying to assess the size and shape of the lower lateral cartilages, if there is any asymmetry, if there is any bifid deformity, or if there is any rotation. A lot of different tip configurations can occur in relation to these characteristics. For example, this is what the bifid nose will look like. This is a boxy nose, this is a bulbous nose, and this is an amorphous nose. So these are all tip deformities that you will be looking for over here. Next is tip rotation. Now, what is tip rotation? This will describe the position of the tip along an arc with its radius centered on the nasolabial angle. So, if you look in the image over here, nasolabial angle is this angle. And normally, this angle is about 90 to 95 degree in men and 95 to 105 degree in females. So, the position of the tip in relation with its radius on this nasolabial angle is assessed to see if there is any rotation of the tip or not. And the last thing that we'll inspect in the external nose is known as the columellar show. Now, what is columellar show? So we will be drawing two parallel lines. Let's look at the image here. We can see that there are two parallel lines drawn over here. One is at the level of the most anterior part of the nasal vestibule, and one is at the level of most posterior part of the nasal vestibule. The columellar show is actually the distance between these two parallel lines. That is known as columellar show. Now, what are we assessing here by looking at columellar show? We are basically trying to assess the relationship between the ala as well as the columella in the lateral view. Now, ideally, the amount of visible caudal septum that you are able to see in this lateral view should only be about 3 to 5 millimeter. So, your columellar show ideal number is about 3 to 5 millimeter. Any columellar show which is greater than this, or maybe it can be because of different reasons. If it is greater than this, it can be because there is a hanging columella or any abnormality in the alar margin, such as notching or any retraction. So this is how we assess how much columellar show should be there, and if there is any deformity in the columella or not. So this was about the inspection of the external nose. What are all the things that we will be looking at? Next, we'll be moving on to discussing what are the things we'll be inspecting in the internal nose, meaning inside the nasal cavity. So we'll be examining the internal nasal cavity, and this is a very important part of your assessment for rhinoplasty, because there may be abnormalities inside the nose that you may also need to correct. Sometimes we perform a septorhinoplasty, where we combine a septoplasty with rhinoplasty together. And this is also important for your assessment of the donor cartilage sites. So what do we do here? We should perform an anterior rhinoscopy as well as a nasal endoscopy to look at the inside of the nose. Now, first of all, we'll look at the septum. Is there any deviation or spur or any perforation in the septum or presence of a septal button? If anything needs to be corrected, then we look at the lateral nasal wall. We identify if there's any congestion, if there's any hypertrophy of the turbinates or any asymmetry. Then a very important, very important part is to assess the internal nasal valve. This is very important to do because this will determine your nasal obstruction, if there's a functional nasal obstruction. So this has to be done during the time of normal quiet respiration at rest, because if you try to do this during when the patient is having an exaggerated breathing, it will probably precipitate a transient internal nasal valve collapse in a normal individual even. So an internal nasal valve assessment has to be done when normal quiet respiration is occurring at rest. Second is we do the Cottle's test, where Cottle's test is a test where we pull the cheeks laterally and we see whether the nasal obstruction of the patient improves or not. If it improves, we usually think that the problem may lie at the level of the internal nasal valve. However, this is actually a very non-specific test. A better test would be to place a Jobson horn probe in the internal nasal valve to prevent the collapse of the upper lateral cartilage and then detect the effect of this on inspiration of the patient. So this is how we are going to assess the internal nasal valve. Next, we also look at the alar collapse. Alar collapse is actually a measure of external nasal valve collapse. So I've spoken a little bit about the external and the internal nasal valve boundaries in my surgical anatomy video on the nose. But if you want to know more in details about the internal nose anatomy, you can check out my video on the anatomy of internal nose, which I have linked above. So, determining both internal as well as external nasal valve collapse is very important preoperatively. And lastly, when you perform endoscopy, you can exclude all other things like maybe the presence of polyps or purulent discharge or any residual adenoidal tissue. So, we'll do all of this to assess the internal nose. Next, we move on to discuss about the palpation. What are the things that we will be palpating? So, first of all, is skin. We try to assess what is the skin texture like and what is the elasticity of the skin in this patient. Then we look for any irregularities. If there has been any irregularity because of the skin, the soft tissue, the cartilage, bone, or any previous graft material, then we palpate the nasal bone. We assess the size, the position, and the presence of any palpable steps over here. Then we also see tip recoil. What is tip recoil? This is actually an assessment of the strength of the lower third of the nose, and it is a palpable measure of the degree of underlying tip support. Then we palpate our alar cartilages to see the thickness, strength, and shape. And lastly, the spine and the septum to assess for tip support and to confirm the presence and quantity of the septal cartilage. So, this has been about the assessment, the inspection, as well as the palpation of the nose. Next, we will be talking about some angles which are very important to know about in relation to rhinoplasty. So, first is we have the nasofacial angle. So, let's look at the nasofacial angle. What is this angle? This is actually also known as the angle of nasal projection. So what is the angle that we are measuring over here? So here we measure, first of all, we pass a line which is touching the nasion. This is the nasion over here and the chin. So first line is touching the nasion and the chin. And the second line would be the dorsum plane of the nose. So the angle which is formed between these two lines is known as the nasofacial angle. And ideally, this angle should be about 35 degree, but it can vary between 30 to 40 degree. So this is our first angle, which is the angle of nasal projection, also known as the nasofacial angle. Between two lines, the first line is which is touching the nasion and the chin, and the second line is passing along the dorsal plane of the nose. The second angle that we are going to look at is the nasolabial angle. So this is the angle which we are measuring between the columella and the plane of the upper lip. So this line is the line at the level of the columella, and this line is the level of the upper lip. The angle formed between these two lines is known as the nasolabial angle. Now, ideally, this should be about 90 to 95 degree for males and about 100 to 110 degree for females. Third one is the nasofrontal angle. So this is a line which passes along the glabella. So here is the glabella. So this is the line passing along the glabella. And second line is passing along the dorsum of the nose. The angle formed between these two lines is known as the nasofrontal angle. And the ideal angle would be about 125 degree. And this angle gets obliterated in a Gratian profile. So these are the three angles that you definitely need to know in relation to rhinoplasty. Next, we move on to another important part, and this is going to be pre-operative photographs. So taking pre-operative photographs in a case of rhinoplasty is extremely important. So this will not only help you for planning the surgery, but also you can have an evidence with you in case for any litigation purposes, and even show your patients that this was the pre-operative and the post-operative result. So it's very important that pre-operative photographs are taken. There's a lot of guidelines to follow on that. So I'll tell you a little bit about that. So usually we take about 4 views over here. We have the frontal view, the right lateral and left lateral view, and the basal view. The right lateral and the left lateral view, these two are known as the profile views. So we have 4 standard views that we are taking over here. First is the frontal view. Now, frontal view is basically where we are positioning the head of the patient such that you are able to see equal amounts of the pinna, and the horizontal position of the eyebrow is maintained. So this is our frontal view. Here, this at this view, you should also take a photo of the patient where they are smiling, because sometimes on smiling, not sometimes, you'll see that on smiling, that the tip can get some unduly depressed, and there may be excessive alar flaring. So it is important to take the photo in a non-smiling face as well as a smiling face. So this is about frontal view, and what are some things we will be looking over here. So we will look at the length of the face, the width of the face. We will look at the size of the forehead. We'll look at the width at the root of the nose, at the tip of the nose. We'll also look at the length of the nose between the root of nose and tip, and the root of nose and alar facial junction. And a line which is drawn from the medial end of the eyebrow to the side of the nose should be, we already spoke about this, the brow tip line, that should be a very smooth line. These are all things that we will be seeing in the frontal view. Another thing to know about here is the vertical distance between the medial canthus and the nasal dorsum at the root of the nose. This vertical distance should be about 1.5 centimeter. So these are the things about the frontal view. Next, we come to the profile view. Now, profile view, we examine the profile of the nose from each side. In the right lateral view, for example, the left eyebrow, if you look at the image, the left eyebrow should not be visible, and the neck should be straight without any flexion or extension. Same applies for the left lateral view as well. Now, what are the things that we will be seeing over here? We look for the slope of the forehead here. We'll look at the dorsum nasal line. We'll look at the columella show that we spoke about. We'll look at the lip and chin relationship. We'll see whether the chin is under projecting or over projecting or receding. Also, we'll see at the size and contour of the lips. These are all things that we will be seeing in the lateral view. And the nasolabial angle should be obtuse and present a gentle curve. So this is our nasolabial angle over here. These are all things that we are going to be seeing in the profile views, both the right lateral and the left lateral. The third view is the basal view. Now, what is the basal view? This is when we tilt the head of the patient backwards to the full extent. And the view that we get here is known as the basal view. In this view, you will be seeing that the nasal base seen from the bottom actually gives the appearance of a equilateral triangle, right? You can see that this is looking like an equilateral triangle, and the columella is in the center of this triangle. From the basal view, we will divide the nose into 3/3. Let's look at the image here. This is the basal view. You can see how this looks like an equilateral triangle. We'll divide the nose into 3 equal portions over here. The upper third, this portion, will correspond to the lobule. To understand what is lobule, what is the columella, please refer to the surgical anatomy video that I have already mentioned all of these terms over there. The upper third will correspond to the lobule, and the lower 2/3 will be corresponding to the columella. So these are all things that we will be seeing for in the basal view. Now, it is important to take these photographs because, as I mentioned, first of all, not only is it important from the documentation purpose, but also for your own assessment of the changes that are happening in the surgery, and for record keeping, and even for medical legal purposes in case there is a litigation going on. And also, this will help you in teaching. Some technical points that you may need to know here is that both pre and post operative photographs has to be taken under exactly the same light, intensity, position, angle, and distance. And when you photograph the face, there should not be any makeup, because when you apply makeup, sometimes doing contouring, etc., it can actually distort what the real face looks like. So the face should be photographed without the makeup, and the hair should be arranged so that it is not covering any part of the face. And the camera position must be kept straight at the level of the nose. And usually we prefer a digital camera over the single lens reflex camera because it has a better quality and no film and automated flash intensity judgment, and immediately it is transferable to the computer. These are just some basic things that you need to know. There's way more specifications that is there to be followed during taking photographs for rhinoplasty. So this was about the photograph section of rhinoplasty. Next, we'll talk about the evaluation of the external nasal deformity. Now, we already spoke about the inspection and palpation, but what are some other things that we can use over here? Earlier, there used to be these mechanical measuring instruments which are no longer used. Then there came to be plaster casts, but plaster casts are actually very cumbersome, even though they give a very 3D representation of the deformity. So, in comparison to plaster casts, the wax casts are much more superior whenever they are used. Then you take photographs of your nasal deformity. Then computer imaging. This has been introduced as the latest video communication tool, and this can show on TV monitor how the patient will look after rhinoplasty. Although this is a very expensive tool. Then we have the 3D CT of the external nasal and facial deformities. Lastly, we have the computerized tomography, which is currently used universally and is even being used in India. Next, let's look at what are the investigations that we'll be doing. So we'll do a blood for hemoglobin, bleeding time, clotting time, urine for routine examination. We'll take clinical photographs of the deformity. We'll perform a psychological assessment of the patient whenever it is indicated, especially in male patients. Then we'll perform skin tests for hypersensitivity of the local anesthesia drugs. We'll do rhinomanometry to check for nasal resistance whenever possible. And we'll also do a CT scan of the paranasal sinuses whenever we are suspecting clinically that there is a sinus infection. So these are some investigations that we'll do. Last but not the least, we'll talk about the psychological assessment of the patient. Now, this is very important. A lot of the times you'll find patients coming to you for corrective rhinoplasty for very, very minor deformities, and they may have a underlying psychological disturbance. Maybe they associate their body image issue, all their life issues based on that little bit of a minor deformity that they have. So, and these patients can be very difficult to treat because they may not be happy because suddenly all their life problems will not get solved on solving that minor nasal deformity. So, it's very important for you to be able to assess these things. So, at any point, whenever you're doubtful, do not hesitate to go for psychological evaluation of your patient. Especially in terms of this, the males have been seen to be more difficult patients psychologically for any cosmetic surgery. So I have a list of patients over here that may be problem seeking patients in rhinoplasty. These are all features that you should be careful about when you're assessing. For example, if the patient is unduly concerned about the minimal or an imagined nasal deformity, if the patient has a medical shopper behavior where they have consulted several surgeons and they are not able to choose one, they are indecisive. So, a medical shopper. Then, if the patient is very vague about the physical deformities of the nose and they do not have a realistic view for the surgery, if the patient does not have a rational approach for the deformity in surgery and their expectations and demands are very unreasonable, then an emotional, unstable, or hysterical individual who are expecting that who expect that maybe to alter their personality by getting the nasal shape changed. This is the kind of patient that I was talking about earlier. Then indecisive male patients, rude and uncooperative patients, patients who come to you shabbily dressed and unkempt hair, patients who are already involved in some kind of litigation, and even VIP patients. These are all the patients that will be much difficult to treat. So you should be very aware of these points and assess properly before you take on somebody for rhinoplasty. So that's all about the preoperative assessment of rhinoplasty. If you have any doubts regarding this, please note them down in the comment section and I'll get back to you. Thank you.